Hi, Carla again from Neurospine Physical Therapy. This is Becky. She's our jack of all trades, front office, back office, anything we need. Today I want to talk to you in our 2-minute tips about how to set up your workstation to make it a little bit more ergonomically correct to protect your spine while you're doing your work activities. We'll start at the top and we'll work our way down. Ideally, you want your computer screen to be set up so that when you're sitting in a relaxed position, that the middle of the screen is at eye level. Ideally, I would have this brought up a little bit, but that does a little bit interfere with her ability to see patients, interact with patients. So we would set up things a little bit higher so that she's not looking down and her neck's in a nice relaxed position. Over on this side, I would have both screens so that she doesn't have to do a lot of twisting of her head. So they should ideally be about the middle of the screens right here, so that it's just a quick little eye look to either side. Okay, so first is getting your screen height set so that you're having less stress on your back by having the middle of the screen at eye level. Okay, the next thing is to get your keyboard set so that it's at the appropriate level. If you need to raise your chair to do that, or if you need to get a drop-down keyboard tray, those are two options that you can do. Ideally, you want your arms to be in about the position you would as if you were to hold a bag of groceries in your arms. So have your arms there and then flip your hands over, and that's about the position that you should be in as you're typing on the computer. It should be in front of you. It shouldn't be off to the side so that you have less stress on your back. Okay? Then adjust the armrests so that they come up and hit just underneath the elbows, so you're not having to reach for them and they're not pushing your shoulders up, but just so they give you just a little bit of support underneath those elbows. So then as you're sitting in the chair, what I'm going to do is have Becky scoot back just a little bit. Okay? When you sit in the chair, the main point is you want to scoot your bottom, reach over, scoot your bottom all the way back into the chair before you sit down. So Becky, go ahead and lean forward, scoot your bottom back, okay, and then go ahead and lean back. Okay, you want to be able to have your shoulders over your hips when you're sitting. So Becky is not quite in a perfect position, so I would either take something as simple as a lumbar roll to put behind her back to give her a little bit more support, or even something as simple that you have with you like a towel or maybe a sweatshirt, and just slide that right behind the back so it gives you some extra support and you can be pretty relaxed in that position. Ideally, you want your knees to be set at 90 degrees with your hips or just slightly below hip level. Okay, and your feet should be resting flat on the floor. If they're not resting flat on the floor, you can ask somebody in your ergonomic, in their HR department or in the supply department to see if they can order a little step stool to put your feet on. Or I did something simple here by just grabbing a simple ream of paper or a phone book that you might have in your desk drawer. You slide that and put your feet there, and then that in general will decrease those stresses and strains on your back while you're doing the normal everyday activities. Make sure you get up every hour and do some walking, because sitting is the most uncomfortable position for the disc and most unhealthy position for the disc. So making sure you're getting up and moving as much as possible is going to help keep things in your spine happy, happy, happy.